I'm so frustrated. The same problems and mistakes are continuously repeated. There's a huge optimization of time, resources, and interventions. We need something to improve this situation.
Progress cannot be generated when we are satisfied with existing situations. All we are doing is looking at the timeline from the moment the customer gives us an order to the point when we collect the cash. And we are reducing that timeline by removing all these non-value added wastes. This is what is called lean management. Hi everybody, and welcome to Kids Out, the space where we are trying to spread some knowledge about different topics. I am Samuel Gonzalez, and my partner is Ines Blanco, and today we are going to talk about lean management applied in healthcare systems. So let's start. As you may know, hospitals are infrastructures that play a key role in the success of a well-defined system, so having a good coordination between the department is essential to guarantee its correct functioning. On another hand, minimally invasive surgical procedures, also known as MIS, increase every year as the best alternative against the huge demand of surgical interventions that public hospitals assume every day.
However, these emerging MIS techniques completely change hospital dynamics. The problem is that they don't have the necessary resources in order to adapt these new technological advances to the usual clinical activity.
So, in order to face this current problem, new protocols for hospital circuits could be designed following the lean process management. It consists in analyzing processes that require a strict organization in order to improve them and prevent wasting resources. It was created focused on the automobile industry, but the principles could be also implemented in healthcare management by considering the patient as the customer.
The Toyota Production System TPS, also known as the Lean Manufacturing System. This is based on the pull system, which means we only produce what is ordered.
As Taiichi Ohno, one of the fathers of lean methodology, once said, progress cannot be generated when we are satisfied with the existing situation. That is why one of the key aspects behind this methodology is the continuous improvement, by constantly analyzing every step of the process.
So, three main concepts I apply in lean methodology, and they are the ones that we will try to remove, optimize, and redesign. The first is MURA, that is defined as waste, any activity in a process that consumes resources and do not add value to the product. The second one is MURA, that is defined as variability, any variation not planned that causes irregularities in a process. And the last one is MURI, defined as overload, any activity that requires effort in terms of human resources or material above the capacity of the system.
Now we can talk about the 5S method that is recognized as the foundation of lean healthcare approaches. It is a system used to reduce waste and optimize processes through maintaining first an orderly workplace and also using visual tools which maximize value add levels by removing or reformulating factors that are considered as waste, muda. These 5S come from 5 Japanese words that stands for the 5 key steps in this methodology. These are seiri, sort, seiton, set in order, seiso, shine, seiketsu, standardize, and shitsuke, sustain. 5S has recently received attention as a potential solution for improving healthcare service in low and middle income countries.
As Ines said, lean methodology is based on 5 principles. The first one is defining value, which means identifying what is really valuable for the customer, that in our case refers to figure out what the patient's needs are. The second one is set in order, where tools are used to analyze the processes, eliminate those that do not add value, and organize all the procedures left in a logical way for optimizing time and resources. One important tool here that we will explain further is value string mapping.
So the third and fourth steps are flow optimization and stabilizing pool. Here, the aim is to create a set of standards for both organization and processes. These standards can involve schedules, charts, lists, Stabilizing pool simply means that you are responding to customer or patient demands as quickly as possible without creating excess inventory and increasing productivity. The final step is sustain, doing a continuous improvement. This means that the previous 4S, sort, set in order, shine, and standardize, must be continued over time.
Now, let's introduce some of the tools that explain the success of the Lean methodology. The first one is High-Level Process Flow Map, which is intended to be a high-level view of the steps required in a procedure, mapping the current state process and then brainstorming about the possible improvement.
One important tool in Lean methodology is the value stream map. It's more detailed because it includes the timing associated with each step in the process, the flow of material, and the flow of information, and also help in the design of the ideal future state. For implementing this tool, we need to follow 4 steps. First, start by understanding the entire process by capturing actual information before making any changes. Then, analyze this information, seeking for barriers to flow and the negative impacts. Next, we need to create a future state value stream map to document the ideal process with improvement ideas incorporated. This should be created with a focus on understanding the patient demand, implementing continuous flow, and evenly distributing the workload. The last step is taking action by implementing Kaizen plans, where Kaizen means continuous improvement.
As we already mentioned, one of the driving principles of Lean is removing waste from operation. For this waste analysis, Taichi Ono designed the 8 Wastes Lean categorization or MUDA.
First, we have defects, manufacturing errors that have a direct impact in quality. For example, defective personal protective equipment, misdiagnosis, or default in laboratory analysis.
The second one is waiting, such as patient waiting in exam rooms, delays in laboratory or image diagnosis results, appointment waiting list.
Then we have inventory, products stored that do not add value, such as expired medications, overstocked consumables, or excess or besides equipment.
The fourth is the motion, unnecessary movement of staff and patients within the installation. For instance, when a patient is displaced to the incorrect unit.
The next one is overproduction, unnecessary diagnostic tests, uneaten meals, ordering medication that patients don't need.
Following, there is transport, logistic problems with material or people in large distances, such as transferring medication from pharmacies to health centers.
Another one is extra processing, ordering complex diagnostic imaging, MRI, when simpler methods would be enough, X-ray or physical exploring. Also, treatments done by specialists that primary clinicians could do.
And the last one is non-utilized talent. Non-listening to employees, pressuring people to hide and cover up problems, people habitually working below their level of licensure.
In the USA, the application of Lean methodology in healthcare has become more popular than in Europe. Several examples of successful implementation exist, such as the Virginia Mason Medical Center. In 2002, became the first healthcare institution in adapting the Toyota production system philosophy to healthcare.
Their benefits were saving $11 million in capital investment, reducing the time in reporting laboratory test results in 85%, reduced inventory cost by $2 million through standardization efforts, and they increased productivity by about 93% in some areas, among others.
Other measures considered were to redesign the oncology service with a laboratory and pharmacy inside, so this reduced the patient's chemotherapy visit from 10 to 2 hours and save about 500 feet of walking.
Some other examples of Lean method in institutions are TedaCare, that redesigned patient's room. Nurses got to spend 70% more time with patients by relocating supplies, medication, and electronic record system into patient's room. Another one is Nicklaus Children's Hospital in Miami, that reduced preventing crash inspection time from 3 hours to 10 minutes through visual optimization and the reduction of excess supplies and equipment.
What we have learned with this key talk, that Lean can help to remove wastes such as duplicated information, defective products, rework, missing supplies, and staff burnout. Also helping reducing frustrations and dissatisfactions.
By deploying Lean healthcare, organizations are also improving satisfaction of patients as the decision and processes become more and more patient-focused.
So that's all for this key talk. We hope you like it and that we will be together next one.